Heart disease, as many of you know, is the #1 killer. There's more deaths from heart disease than cancer or accidents combined. There's about 500,000 people who die from heart attacks every year, and often the first symptom is actually that first heart attack or death. Getting people engaged, getting people evaluated, finding out what's going on with their heart before these devastating events happen are really key. And so we've developed not only fantastic screening processes, but if you are unfortunate enough to come in and need cardiac care, we can provide it to the very highest level of these facilities.
It's a team effort. You know, I cannot do it by myself if I didn't have the support of my team, if we didn't have well-trained nurses, technician, scrub tech or x-ray tech. It's a team effort. Everybody has a specific role during the procedure to pay attention to, and if it's not from this team effort, the procedure wouldn't be done successfully.
And it's been the contributions of our physician-led team, the nursing staff, the technicians, really everyone from the bottom up that have contributed to make this the best program we have in Arizona.
The patient comes first. We are there to get you in. We get that initial call. The patient's being picked up by transport wherever they're at, whether they're calling for a chopper or a 911 ambulance. The cath lab team is getting the room ready. The cardiologist is usually on site. The patient is moving in seamlessly. They're running through the ER bay doors straight up to our cath lab. Many times we're getting those vessels open in record times.
What's unique about these two facilities and unique in the state of Arizona is we actually have a cardiologist physically present at these facilities, ready to see you the minute you hit the doors.
I think it's important for patients to know that we treat our patients as if they're our family. So the decisions that we would make for, our own mothers and fathers. And I think when you take that approach, that they feel comfortable with the decisions that we make and knowing that we're going to give them the care that they deserve.
The fact that I have a vascular surgeon, a cardiothoracic surgeon, my other interventional colleagues available to me at any point when we come across the complex cases to get advice from, and also, try to form a good plan for these patients together. And I think it helps the patient tremendously.
People work with passion here, and I've seen teamwork in terms of nurses, doctors, all the supporting staff. They go out of their way to try to help the patients out, and that is a very distinct feature.
We're geared to make this not just the best experience of the patient, but a lifetime experience where the patient knows that he will be cared for every time he comes in, that hey, this is the place to be if I want to have good health.
We're lucky that in this valley we have the latest technology. Also in peripheral arterial disease, we've been at the forefront of the technology here in reopening those vessels. Again, patients who they didn't have an option years ago of having their vessels opened. We have more techniques, more equipment that enable us to open those vessels and establish a flow to those limbs. One, to relieve their symptoms, their cramping in the calf or burning in the feet, but more importantly to prevent amputation on the long run.
One of the programs we have here is called cardiac CT angiography. And in layman's terms, this is a three-dimensional or 3D image of the heart. This technology is fantastic. Within 5 seconds, this camera takes 400 pictures of your heart, and they're each about 0.5 millimeter thick. And it stacks that data set and imports it into a 3D computer where you have a perfect reconstruction of your body.
I've only ever wanted to be a cardiac nurse, and I'm so glad that I was able to achieve that and to do that here at Chandler Regional. I work with the best physicians, and to see a patient go from their absolute worst to their absolute best in less than an hour is utterly amazing.
We literally touch your heart, and you would feel that when you come to any of the cardiologists.
The team works together fluidly to make sure that patient gets the very best care that they can get. And hopefully we're sending people home to their families. And how do you put a price on that?